Hello and welcome to all our listeners to an exciting episode of the Medgate Today podcast, where we bring you the most insightful conversations from business perspective and world of well-being in the world of healthcare, pharmaceuticals, diagnostic and medical device advancements. In today's podcast, we have Mr. Abhishek Vaish. He is an orthopaedic and joint replacement surgeon, a specialist in a complex trauma and sports injuries with over 9 years of experience. Hello, sir. It's our pleasure to host you in our today's episode of Medgate Today podcast. So, first of all, let's dive into the basics of orthopedics and hear about your story. So, could you please tell us about yourself and a little about how you came into the healthcare industry?
Right. So I have around 40 doctors in my family. So I have been looking at doctors since I was a child, and I have always been fascinated with this world of treating and seeing patients coming and getting better.
Yes.
So I've always never thought about anything else since the childhood. So that's how I entered this field. I was very clear. My father is also an orthopedic surgeon,
Yes.
so I have always been seeing patients coming with fractures, plasters. So it was like a routine thing for me. So my medical school was more of fun than slogging or trying to do a lot of hard
Because
work.
you were very habitual since your childhood only.
Yes, so I used to ask a lot of questions to my grandfather, to my father, to my uncles, all about medicine. I was accompanying them to the hospitals. I've also attended our operation theatre when I was just 12 years old.
Oh my God.
So that's how I entered this field, and I just love it. So it's not that I go to work, it's like I am enjoying the whole day.
Yes, it's just like a part of your life. You're not just getting any kind of, you can say, stress from your work. You are just enjoying it like a life.
Absolutely.
So, sir, as in the description of yours, I said a specialist in complex trauma and sports injury. So, let's start with the basic. What is complex trauma and what is sports injury? And how these two terms are different from sprains and fractures?
Right. So complex trauma is any fracture which happens around the joint, or if it is happening in your long bone. It is severely fractured, and with complex trauma you don't just mean accident and injury to the bone. There are a lot of soft tissues around the bone, so they also get injured. Sometimes the blood vessels, the nerves also get injured. That is how the fracture becomes complex. It becomes a little more complicated.
And that's why it's named as complex.
Correct.
Okay.
So mainly what people understand by complex fracture is that the fracture is around the joint, which is very important to treat rightly. Otherwise the patient will land up with joint problems like osteoarthritis. So if the patient has fracture around the knee joint and it is not treated properly, the joint is not put back in its place properly, then the patient will have early osteoarthritis. So we have seen patients who have been treated, 20-25 years old boys who have got an accident, did not get treated properly. Now they have osteoarthritis in the age of 30-35 years old. So the only option if you have severe osteoarthritis is joint replacement.
Okay.
Which now is changing again with the recent advances in regenerative medicine. So we can do a lot of things now. But again, you said sports medicine. Sports medicine is another ball game. So nowadays people are getting into sports. There is a lot of awareness. So people are playing all sort of sports like cricket, swimming, tennis, football. So as people are getting more into sports, it's obvious that these people will have more sports injuries. The problem is many people are weekend warriors. What I mean by weekend warriors is that they are working for 6 days a week, they are not fit, and they go to play maybe cricket or any other sport without warming up, without cooling down. These people land into more sports injuries. We are seeing more people who have these problems. They are not athletes.
Yes.
So sports injuries is very common. The most common sport injuries which we see in our practice are ACL injuries, that is a ligament in the knee. Then there is impingement in the shoulder problems. Some people have torn meniscus, that is a cushion in the knee.
Okay.
So these are the common problems. Then there are rotator cuff injuries in the shoulder joint. That rotator cuff is a muscle which helps lift your hand. So if it is torn, then you cannot. So these are the common problems which we face, which we see in our practice. And most common, again, one of the common problem is ankle injuries, ankle sprain.
Yes, ankle sprain.
Yes. So many people think that it is just a sprain. If I put some ice, garam patti बांध लेंगे, crepe bandage लगा लेंगे, ठीक हो जाएगा. But if it is not treated properly, sometimes these patients land up in chronic problems. And I have seen these patients getting problems for years if not treated well.
Okay, so how can we like treat our sports injuries? If it is very minimal at home.
Right. So you should follow the RICE principle. The RICE principle is rest, ice, compression, and elevation.
Okay.
So, for example, you get a twist in the ankle. So what do? You stop where you are. Don't try to push it. Don't try to walk home.
Okay.
Rest. Apply a lot of ice. Compress it with a crepe bandage, and keep it elevated. Use some help to reach home. Then see your doctor. Sometimes you think that it's just an ankle sprain, but it could be a fracture as well.
Okay. So people who get some kind of sports injuries, please do follow the RICE principle. So moving forward, sir, nowadays from a lot of orthopedicians that internal bracing, there is one term and a lot of patients ask this term to the doctor. So what is it and how it is like making it in the nowadays life?
Right. So ACL, that is anterior cruciate ligament injury, is very common, and the treatment of choice is reconstruction of the ACL ligament.
Okay.
So there are many techniques nowadays which we can use to give a patient a good result. So what is internal bracing? Internal bracing came 10-15 years back, which was used commonly. For example, if you have an injury in your knee and your ACL is completely gone, it was believed 10 years back that because of the bleeding inside the knee, it is not safe to do a ACL reconstruction immediately. In that case, what we used to do is we used to use a thread which we used to use to fix the lower bone and the upper bone, that is the tibia and the femur, like a brace internally to support the knee so that the knee doesn't get further injury till the time we are doing a reconstruction.
Okay.
So this was what was happening initially. Nowadays, what internal bracing mean is if you have a partial ACL tear, it is not important or it is not required to reconstruct the whole ligament. What we can just do is use this brace, use this thread to support the already torn or partially torn ACL to help it heal. So we are augmenting, we are supporting the already available ACL to heal itself. So it's a surgery, it's a same surgery but a little minor one, and you're helping your own ACL heal. So this is what is internal bracing.
Okay. When I asked you a question of complex trauma, there's one thing which is nowadays very common, that is 3D printing. So what is 3D printing and how it is making very ease in the orthopedic industry?
Right. So 3D printing is the new technology which has come in and we are using it regularly. It started with, aviation industry. They used to do a lot of 3D printing to improve their aeroplanes.
Yes.
Nowadays we have 3D printers in our offices where what we do is, suppose a person has a complex fracture of the knee where we don't know how the anatomy is.
Yeah.
So what we can do is we can do a CT scan of the patient's knee and we have special softwares where we can find how much the bone is broken, where it is broken, how to lift it up, how to fix it properly 100% according to how the patient's anatomy should be. And we can also get the same model printed in our offices even before we have taken the patient to operation theatre.
Wow.
So what it does is, one, we are confident, we know what to do.
Yes.
Number two, we can order specific plates or whatever we need to fix that fracture.
Yes.
We can even make custom-made implants for that patient. So it is not one size fits all. So according to the patient need, we can print that specific plate. Number four, we are going in the operation, we are using less time So patient is under anesthesia for lesser time.
Yes.
There is lesser blood loss.
Exactly.
And the most important thing is we can explain to the patient what is going to happen to you
Before
on the same model which the patient, on the patient's own anatomy.
Yes, exactly.
And now if we talk about, because we are doing a lot of teaching and research, so what we can also do is we can teach our colleagues, we can teach our juniors. So everybody is on the same page when we take the patient for the operation. So
yes,
very good results, functional outcome is good, patient can move very fast, early recovery, win-win for everybody.
And there's less chance of any human error also.
Of course.
Yes.
Of course.
So in this 3D printing, there's one next thing, that is robotic surgery. So could you please tell us more about robotic surgery and how it is aligned with the orthopedic?
Yes. So in orthopedics, robotic surgery we are mostly now using for joint replacements. So if we say we with robot we are doing hip replacements, we are doing total knee replacements, we are doing partial knee replacements and shoulder replacements, spine surgeries. So what it does is, again, we do a CT scan, we know the patient's anatomy, we can plan what is the amount of bone we are going to cut, precisely what angles do we want to correct. Like if a patient is coming with bow legs, we want to correct it to a 180-degree alignment, we can do that very precisely to a 0.5 mm error, and then we can specifically order those implants which are required for that patient. So again, less blood loss, faster recovery, lesser bleeding and lesser pain.
If I say our generation and the young generation, like our father and mother, but the older generation who is not aware of robotic surgery, how you make up their mind to go for this kind of surgeries?
Right. So first of all, I want to clear this myth. Some people think that robotic surgery means the doctor is sitting somewhere having tea and the robot is doing the operation.
Yes.
It's not that. So the robot is assisting the doctor. The surgery is done by the doctor himself. We can take over whenever we want and we can modify the plan as per our needs.
Okay.
So it is not the robot who is doing the surgery. Robot is just guiding us and telling us, so this is the plan, this is 180-degree alignment which you are trying to do, this is what you have to cut. If we think, no, the robot is, we can do a little bit better for the patient, then we can do that. We can overturn the decision made by the robot and we can take over. So it's the robot is assisting the doctor. The robot is there, it is assisting and it's the doctor is always there. So this is number one myth. Number two is robotics is more important and beneficial for those complex cases. Suppose a patient has a rod inside his thigh bone because of a previous surgery.
Yeah.
Now you cannot do a conventional, that is a routine joint replacement, because you have to put some rods inside the bone to perform that surgery. In those cases, robotic surgeries are very good.
Okay. So the recovery period after robotic surgery and the normal traditional method are same?
So we have done a lot of studies and it is shown that in early post-operative time, that is for 6 to 8 weeks after the surgery, robotic surgery is claiming to give a faster recovery compared to conventional. But if you see in the long run, say 3 years, 5 years, 10 years down the line, then the functional outcomes are same.
Okay. So basically the recovery is faster, but the outcome is same.
Correct.
Okay. My next question to you is, sir, you have done internationally in minimally invasive surgery and yes, cartilage repair technique. So how MIS is changing the game and how it is making everything very smoother and very, you can say, foresight for the orthopedic things.
Right. So orthopedics, when it started, it was mainly done to treat a problem which is already there. So it was more curative. Nowadays, the world is moving towards preventive medicine.
Preventive medicine.
Preventive medicine.
What is it?
That means you are trying to solve the problem even before it is occurring, or you are trying to regenerate or get back the normal anatomy which God has given you. So we are not waiting for the joint, for example, to get damaged fully and do a knee replacement. If we catch the problem early, we have a lot of techniques which you said, like cartilage regeneration,
Yes.
regenerative medicine, which we can do. We have a lot of therapies, like we can do some injections, we have stem cell therapy, we can do arthroscopy, cartilage regeneration. If we catch the patients early, we can roll back the damaged cartilage and we can get the native cartilage. So we can prevent the osteoarthritis from happening, and hence we can delay or maybe forego the joint replacement surgery if the patient comes to us in time.
You said stem cells. So what is stem cells therapy in this orthopedic? Because we have heard stem cells in other things, in other speciality, but we have never heard about in orthopedic.
Right. So stem cells is a broad term. Stem cells are basically cells which we take from our own body and then use those cells to regenerate something, to repair some damaged tissue. So in orthopedics, if we talk, stem cells can be used for genetic problems. Like you must have heard, many people are taking cord blood and storing it. So if the baby has some sort of genetic problems, then these stem cells can be used. But this is not at the moment approved by a lot of regulatory bodies, so it is still under research. Another thing which you can do with stem cells is to help grow the bone. So if there is a very resistant type of non-union of a fracture which is not healing, then the stem cells are very beneficial to, if you put the stem cells around the fracture, the bone heals beautifully.
Okay.
Then the other thing is cartilage damage. So cartilage, if for the benefit of the viewers I am saying, it is a layer over the bone ends in the joint which helps in smooth functioning of the bones. So if the cartilage gets damaged, then it is called osteoarthritis.
Osteoarthritis, okay.
Yes. So we are trying to preserve the cartilage and regenerate the cartilage, which we can do using stem cells, and we can program the stem cells to make only cartilage. So stem cells are like babies. A baby can become a doctor, a baby can become a lawyer.
We can mold it like
Correct.
however we want.
Absolutely.
Okay. You said osteoarthritis. So are there many types of arthritis?
Yes. So there are more than 100 types of arthritis. So arthritis in general is derived from two words. Arthros means joint and itis means inflammation.
Okay.
So any
Joint
inflammation of the joint is arthritis.
Okay.
Most commonly used terms are osteoarthritis, that is degenerative problem of the joint, and then other most people know is rheumatoid arthritis.
Yes, rheumatoid arthritis.
जिसको गठिया बोलते हैं.
Exactly.
तो ये एक inflammatory type of arthritis.
Can we treat rheumatoid arthritis? Is it treatable?
So rheumatoid arthritis is something like diabetes and hypertension. You have to control it. Some people have the tendency, if they have a family history, to have rheumatoid arthritis. We can control it and the patient can live a very normal life. But if we identify it in time, the patient does not have deformities in the, you must have seen patients with crooked hands and legs and toes. So that is end stage arthritis where the joints have already been damaged. So if we catch the patient early, we can give simple medicines and the patient can lead a very normal life.
So is it necessary to have the medicines all the time, or you can just take it when you have any kind of pain?
So it is dependent on patient to patient and it is more symptomatic. So if someone has rheumatoid arthritis, for example, grade 1, and the patient does not have any symptoms, then the patient does not have to take any medicines. But usually what we have seen is this patients with inflammatory arthritis get aggravated during maybe season change.
Yes, exactly. During winter, most important.
Right. So if there is a season change, if they change their diets drastically, if they are getting pregnant in the postpartum period, if they are stressed, if they are depressed, so if there is a sudden change in the metabolism of the body, then these problems aggravate. Then we may need to increase the dose of medicines. Otherwise it is fine.
If we overthink, does it also have affect the rheumatoid arthritis?
So rheumatoid arthritis is an inflammatory problem. So if your body HPA axis, that is your brain works, it releases cortisols.
Okay.
So if your brain is stressed out, it will release more cortisol.
Oh,
There will be more inflammation in the body, and that will aggravate your arthritis.
Because one of my known person has rheumatoid arthritis. So the thing the doctor said is, don't take medicine, just stop overthinking.
Correct.
So that's why I just wanted to know how overthinking is connected with the rheumatoid arthritis.
Correct.
So I got to know like these hormones, what you said is like aligned with these type of things.